break out a needle. It's time to get on gear.
I think I've said it before, but I always play around with the idea of kind of once I hit 50, I'm like I've like maybe just like you know what, let's go. Let's I've probably hit my genetic limit at that point. It might be fun to kind of just experiment a little. Like what do I have to lose at that?
I mean, hey, it's like there was a comedian, shoot, I'm trying to remember who it was, where he was like, you know what, at some point, I think I'm gonna try heroin whenever I'm like 80. Because once you're 80, it's like if you overdose, no one's gonna be like, oh well, he never got to.
Live, yeah,
Yeah, you know what? Actually, he had a good life. Yeah. Like
yeah, yeah.
you figure it's got to be fun once. That's
Well,
why they do
yeah,
it again and again, and they decide, you know what? I'd rather have heroin instead of a
yeah,
home.
yeah, exactly. So yeah, maybe wait till you're a little bit older.
Yeah, but like the testosterone, like getting on some gear, if you're like, man, screw it, I'm 50, 60 years old, and this is what I've always been curious about trying, and
Yeah,
like kids are grown out of the house. I've got my life all together. I've got everything all paid off. We got house, got like a camper, a boat. Like you're living a good life. You want to go out jacked and tan? Why not?
that's what I always say. I'm going on Jack and Tan, baby. Like I'm gonna be the most Jack grandpa or older guy out there.
Hey, leave a sexy corpse, right?
That's yeah. I need the XL coffin.
So
Well, that got dark there for real quick.
it really did. No, like in all seriousness, this is something that I talk to a lot of my clients about. Today's episode is going to be about testosterone, natural, how to maybe optimize it, what are things that can help, talking about genetic potentials, and then also what would be the signs for should you get on TRT and what is the difference between true medical TRT, which is what I've been on for over 10 years, versus actual gear blasting a cycle. So let's start with differentiating, right? So like I mentioned, I have been on TRT for a little over 10 years now. Whereas Tyler, you are a lifetime natural athlete who's competed in both bodybuilding and powerlifting.
Yeah, that's true. I am all time natty so far.
So let's talk about the definition of natural. I'm going to keep it just super super simple. Look, creatine is not a steroid. Anything that you buy at GNC that says it's going to boost your testosterone just because you take it doesn't mean that you are not natural anymore, because also there's a very small chance that they actually use an effective dose of whatever the main active ingredient is. So natural means like, hey, you've never taken testosterone cypionate, you've never taken testosterone ethynate, you've never hopped on any Anavar, you've never hopped on Tren or any of this fun stuff, right? Well, allegedly fun stuff. So
Allegedly.
because
Yeah,
there's definitely side effects and a lot of risks. But
yeah, big time.
when we talk about natural, you're going to have your genetics that will play a big factor in what is your potential for where you fall at in the range. Normal testosterone, depending on the lab reference, the lab that you're using, their reference range is usually going to say normal is somewhere between, it's now moved as low as like 250,
Yeah,
which is crazy because 10 years ago like 350 was
yeah,
low for most labs. And then the high side is anywhere from like 800 to 1,000, which it's slowly also slid lower in the last 10 years. I remember when I first started having some signs of depression, which was my first sign, um, or the first symptom I experienced. I remember the first test that I ever got, the reference range went up to like 1150. I
okay,
remember thinking that's a weird number, but
yeah,
that was what it went up to. So they've like over the years, they've kind of bumped this number down. And we can get into conspiracy theories and,
yeah,
food and all this stuff, but a lot of it does just come down to your lifestyle will be a big determining factor. And I think that's a reflection of the average male lifestyle has drastically changed in the last 100 years.
Yeah. Yeah, and whenever I'm going to have that discussion with a client, it's looking at those lifestyle factors first, right? And I still think like, hey, go get some blood work done. Like, I think it's still obviously worth having that baseline and just knowing, and you get that back, and it's like, okay, maybe it is on the low end of close to that 250, 300, and then you look at some of those lifestyle factors, their alcohol consumption, their do they do anything? Do they work out? Are they active? All of those types of things. And I think, medication should kind of always be a last resort, if you will. It's like, okay, like we've checked off all of these boxes. And, I don't know what the exact timeline would be on it, maybe you, but I would say like at least a year. I would say like, let's give it a year of like, okay, we're doing this on a consistent basis. We're getting follow up blood work. Like, what are we noticing? Is that changing? Is it not? And then it's like, okay, maybe it's time to have that discussion like with your GP of like, okay, well, now is this like a viable option of like, should I hop on this? Like, just kind of a side note, I was having this discussion with a client about GLP-1s and going through her initial consultation, like that thought crossed my mind. And she kind of brought it up at the end of like, yeah, I already asked my doctor about this. And he said no, because a lot of your lifestyle factors aren't actually really in place. And we should probably focus on that first. And I was like, that's awesome. First of all, I
That's a
feel
good
like
doctor.
doctors tend to just jump right to that medication, right? And so I think it's kind of that same idea of like, well, let's look at a lot of these things first. And then if it's still an issue, then let's go start to explore some other alternative methods of that medication. So yeah, looking at a lot of those lifestyle factors and starting to work on those over the course of a year is always going to be that first step.
100%. Now, one other important thing that a lot of people, well, a lot of men need to do is also get a sleep study done, because your sleep is one of the biggest determining factors for, are you putting your body in the right spot to be able to naturally hit your genetic ceiling. We produce testosterone naturally. We produce the most while we're asleep. That's also why whenever you get your testosterone checked, you should check it like fairly early in the morning. There's a lot of labs that won't even take the draw after like 11 a.m. because you want to see, well, what's my ceiling? What's my high
Yeah.
point, right?
Yeah.
So if you're not getting good sleep, and you might think, oh man, I wake up and I get 8 hours of sleep. If you stop breathing 100 times a night because you need a CPAP because you have sleep apnea, that could very well be the only needed fix. And it's also one that will actually save your life. Because if you're needing that machine, it's going to keep the constant air pressure going so that at no point are you depriving your brain of oxygen. If your brain's not healthy, your boys aren't producing test. So that's one big factor. And then, like you said, you should have your lifestyle factors dialed in. If you've got low testosterone and your sleep is good, but then you're drinking alcohol,
Good.
you're drinking a bunch of alcohol,
Yeah.
your diet is absolute crap, you're eating a bunch of processed stuff, it's super low protein, super low fiber, your fats are all just mostly trans fats, you're getting a lot of drive-through foods, you're not drinking any water, you're excessively masturbating. That's another thing that can tank your testosterone levels. If you are smoking, if you don't work out, like all those things will lower your testosterone, and it's a compounding effect. It's not like, okay, well, all of these are equal. It's like, no, if your sleep is horrible, your appetite's probably terrible, you're not getting in any sort of physical activity.
Yeah. My saying is like, it's not a problem until it is, right? And like,
Yeah.
the human body is amazing at adaptation, right? And how we treat it. Like it can take a lot, right? But then like all of a sudden, all of those years add up, and then it's a problem, right? So yeah, like looking at that in conjunction with each other, yeah, it's gonna have that compounding effect.
Yeah, 1000%. So I love that line of, it's not a problem until it's a problem, because then that's whenever people suddenly start realizing how important their health is. And the thing is, Testosterone therapy isn't some magic fix all for your life. It's not like I start putting this needle in me, once a week or once every other week if you're on a really horrible, outdated protocol, or two times a week or three times a week or whatever. Hey, I start jabbing myself with a needle and I'm going to look like, I'm going to look like Sylvester Stallone from Rocky 4.
Yeah.
That is not the case.
Common misconception.
Yeah, like, look, true TRT is designed to take you to what your normal levels should be. And whenever I say the reference range is like 250 to, let's just call it 900, that is men all ages from 18 to, I think it's like 80 or 90.
Yeah.
So the lower end stuff should mostly be accounting for older populations. The younger that you are, the higher it should be. But a man's testosterone levels will start to decline a little more rapidly, typically somewhere in his 30s. So it's a good idea if you're 30, get it checked. And just if your doctor gives you any pushback, you can go on Quest or LabCorp and you can order a standalone test for like $50 and just get your free testosterone checked. And I guess maybe it's a good idea to distinguish between the two. There's a good panel and a bad panel. A bad panel is just checking only your total testosterone. Total testosterone is what I'm referencing of the 250 to 900. But you should also be getting your free testosterone checked as well, because that's what's actually bioavailable. You can have normal total testosterone levels, but then your free testosterone can be super low.
Yeah.
Now, you can also have really low total testosterone, but then your free testosterone can be sky high. So that means that your body is using more of what it's producing compared to someone who, yeah, you're sitting at 800, but your total testosterone's at like 5, which is super, super low. So a good check, a good test is also going to, if you're first having symptoms and you're curious, or like I said, you're a 30-year-old man and you just want to get a baseline to be able to compare maybe like every 5 years, as long as it's normal, you should get your LH checked. That's luteinizing hormone. You should get your FSH, which is your follicle stimulating hormone. Both of these are coming from the pituitary gland and the hypothalamus. So basically, it's kind of like opening a valve, right? And you've got these series of valves. So you have luteinizing hormone, you have follicle stimulating hormone. They signal to each other, and then the next pipeline is moving to your testicles. So you have the hypothalamus pituitary testicular axis, or HPT axis, and if your testicles are receiving enough of the luteinizing hormone signal, then that's where your body starts to produce testosterone. So it's a good idea in your 30s to at least get those 4 tests done. Ideally, you're also checking your estradiol sensitive, that is the active form of estrogen in men. And you should also be checking things like your SHBG and your IGF-1 levels. So all of these things give the total picture of, hey, how is your actual hormone health? Now, let's talk about things that can make the biggest impact naturally. If you had to pick like 2 things, what would you recommend? Like, hey, these are the key things for having healthy testosterone levels as a man.
Yeah. Sleep. I mean, we kind of talked before we hopped on, and like we were going to talk about sleep today, and it was just kind of like, well, no, sleep is good, right? Sleep is great, and so I think that's, as important as it is, it's probably a very underlooked one. Especially now. I mean, you got a family, you're working full time. There's a lot to get done in a day in a very short amount of time, right? And it's probably not uncommon for a lot of guys to, it's 11 midnight maybe, like you're finally getting to bed, and then you're up at 4 or 5 o'clock for work or with the kids throughout the course of the night. So I'm always looking at that fitness level, really, like body composition. Like, you carrying too much body fat, well, there's going to be an easy solution right there. And working strength training. I guess you could kind of pair that then with nutrition, but then poor diet and excessive alcohol intake. Like, I think those are going to be the top three things that I look at. And I think, those are really the three big rocks, if you will, that like, if you could do those three things like excessive stress, burn, like that lack of activity, like it's going to kind of start to take care of itself. Yeah, it's, I remember working at one like personal training job and, working with a lot of affluent people. Man, it was not uncommon for a six pack or a bottle of wine a night, right? Like,
Yeah.
and like that's very, very normal. Like, and it's just, it blows my mind away. Or like, I play hockey once a week again, just like with some affluent, guys around, in their 35 to 45 range. And it's like, they're going out for beers before hockey. Then it's like a 12 pack after hockey. And it's just, the amount. I'm always like, I shouldn't be surprised, but I'm always surprised at it's just the amount that people tend to drink when they're not maybe having they're just not into a healthy lifestyle. And I think that's just a really big one because it's not hard, and it's almost kind of like a low level alcoholic high functioning, right? And then you pair that with going out for a lot of lunches, things like that. And so yeah, those are the three big things that I look at, where they should be obvious, right? But they tend to not be obvious for a lot of people because it has just become such a part of their life and their
Social norm.
social norm, right? Yeah, if you go out and you're going, either you stop at the one or two drinks or you're having none, group mentality, you're almost looked down upon, right? And people are like, oh, like that's odd. So yeah, those are always like the three biggest changes that I'm looking at.
100%. Like my number one is sleep. Like I said, if you're a guy, especially you can kind of look at your jawline and be able to see like, hey, if you have a really shallow jaw, it's a really good chance that you snore. If you snore, it's likely a sign that you're being deprived of oxygen
Yeah,
at night. If you've got like a thicker neck, that's also normal that you can cut your oxygen supply off.
just yoked,
You
baby.
get what's that?
I'm just yoked.
Right? It's my traps, bro. Number two is going to be your lifestyle. So look, 100 years ago, we lived a lot more physically active lives. We had to like you think about 1926. Like okay, we had the roaring 20s, but men worked construction jobs, men were builders, men were doing physically laborious jobs. You didn't have really desk jobs other than like bankers and maybe like lawyers and doctors and like architects, sure, but majority of men were doing physically labor intensive jobs. And what we found in exercise science in the field is that men who engage in regular physical activity, and physical activity is a broad window, like you are physically active, you're doing something, using your muscles, recruiting muscle fibers, causing muscle contractions. Men who are of a healthy body weight, like body fat percentage, typically see about a 10% increase in testosterone levels following their workout. Now, if you're overweight, you're sedentary, your testosterone levels are low, it's actually a bigger increase though. It's
Yeah,
10 to 30%, but your total testosterone levels are probably lower because, and this is my third thing, is improved body composition. When you have more subcutaneous body fat, your body naturally aromatizes, which is the conversion of testosterone to estrogen. Your body naturally aromatizes more testosterone into estrogen. Estrogen, so I talked on the axis, the way your body shuts the flow off is by reading what is your estrogen level. So, hey, you have FSH signals into the pituitary to say, hey, I'm at a healthy level. Go ahead and send this, go ahead and make luteinizing hormone, send it to the testes. Testes then say, oh, I've got enough luteinizing hormone to turn on testosterone production. Cool. Sends up to the brain. The brain loops back with estrogen to say, hey, shut it down. We've reached enough. We're at a high enough level. So if you're of a higher body fat percentage, your body is naturally going to produce more estrogen and a lot quicker to shut you down.
yeah,
I'm not saying every overweight or obese man is walking around with low T, but if you decreased your
chances
body
are.
fat, you will see an
Yeah,
increase in your testosterone naturally.
yeah. So I always say looking good is just a sweet byproduct of a healthy lifestyle. Like, like that's what a lot of people tend to focus on and tend to just forget all of the other benefits, like the literal fountain of youth that like everyone is looking for. In
People
terms
get
of,
it backwards, you know.
yeah,
They start because of the aesthetics,
which is great. Like I think it's a great starting point.
but then that's why most people never stick with it. Whenever you start with, "Hey, I want to feel better," that is such a green flag for me. Is like, "Hey, I want to feel better." I know that the body composition will come as a byproduct of what I'm doing, and this kind of gets back to the book Atomic Habits of, if you consistently do the things that you know are good and in alignment with what your goals are, then your desired outcome becomes the byproduct of that. Like, hey, if I want to read, 10 books a year, if my habit is that I read for 10 minutes every day, it's going to compound and I'll probably eventually get 10 books done in a year. But if I just have the goal of read 10 books, it's like, when am I sitting down and reading though? So let's kind of shift now. So the things you can do to naturally try to increase it, but what are the signs? For a lot of guys, there's so many different symptoms that you might have low testosterone. And it could also just all the crappy part is that they can all be direct reflections of your lifestyle habits, which is why we say get these things dialed in first.
Yeah, yeah,
Number one is going to be energy levels. A lot of guys would just be like, man, I come home and I'm dog tired. I don't want to work out. I don't have energy to play with my kids. I need to take a little nap at like 4:30, 5 o'clock just to be
yeah,
able to get through the evening. That's a big red flag. Now, that could also just be a matter of kids are exhausting. You
yeah,
probably mentally got through a really tough day at work. All of those things are valid, but you shouldn't have zero gas in the tank.
yeah. And that's where then like I almost then go look at, okay, is it that like, yeah, it's just a busy time of life, right? Or yeah, okay, is your sleep there, right? Like, are you getting good sleep? Do you take care of yourself? Like, so you kind of got to start like sifting through some of those things to kind of determine, okay, yeah, like maybe it is so easy to get blood work like you mentioned, and then it's maybe just, hey, it's just worth just go and quick do. But yeah, you can kind of then start to look at some of those things that we mentioned earlier of, okay, can we determine that the lack of energy is potentially a low testosterone issue, or is it just life?
Yep. Now another one, and this was my main symptom. Like I had low energy. Keep in mind, I was 24, I think, whenever my total testosterone came back at like 119, which is so low. That's like 100-year-old man. I think my free testosterone was like 4 or 5. I mean, it was low. My main thing though was depression at the time, because we're talking 2013. We started to have a better understanding of mental health, but I also grew up in a time where the only correlation to depression that I knew of was like, oh, well, you're suicidal. You're thinking about killing yourself. It's like, okay, well, now I know, no, that's not what depression means.
Yeah,
Depression is a broader spectrum, but I didn't grow up in a household that ever talked about mental health. I didn't grow up in a family that viewed therapy as a good thing. Therapy was like, well, you're fucking crazy. That's why you need a therapist, and the therapist is just going to put you on a bunch of drugs. So no,
yeah,
don't go talk to them.
yeah,
Like that was my understanding of it. For me, it was like, well, every day was just kind of gray. I wasn't really excited about anything.
yeah,
Good things would be happening in my life, but it was just kind of like, meh, whatever. And at the same time, whenever bad things happen, I was like, well, I kind of expected that. So who
yeah,
really gives a shit? Move on
yeah,
to the next day, pass the chicken.
yeah. A high level of apathy. It
Bingo.
didn't really matter either way.
Yeah.
Yeah,
So whenever whenever all of these things were happening, now another symptom is low libido. If you either just have absolutely no sex drive, like your sex drive is a very good indicator, male and female, of how healthy are you. A healthy body wants to reproduce. That's just that's biology. That's what humans are. Our basic function, our basic program is eat
Yeah.
and reproduce.
Yeah. 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 Evolution in a nutshell.
Yep. Like, hey, I'm trying to get my grub on and I'm trying to get my bust on. So,
I thought you were gonna say I'm trying to get my rub on and trying to get my grub on.
man, that is better. That is so much better. So, if you're experiencing these things, and there's more to it as well. It could be like, hey, I am physically active, but my recovery is terrible from my workouts. Like that was a big one for me. It would take like I had decreased my training volume and I would still take 4 days to recover from like a moderate chest workout. Now, the good thing is, and this is why it's so important to be your own health advocate. The first doctor I went to just did not listen whenever I said, well, hey, I really don't want to just jump right into like antidepressants because the doctor was like, well, I think you're depressed. And I was like, oh, can we like look for reasons?
Oh
Like, let's
shit,
get
that's
some
why
reasons.
I'm here.
Yeah. So again, I had no clue that I was depressed. I was just like, well, yeah, I'm an adult. Being an adult sucks.
Yeah, it's just sad all the time.
Yeah, like that's everyone who's above the age of 22. Like
Yeah,
once you hit 22, it's like it's all downhill from here. You hit 25 and you get a break on your car insurance. That's
yeah,
it.
that's
Then
it. Yeah,
so, well, I had a really fucking grim outlook on life at that time.
yeah,
But like I having the education background that I do, I remember going, okay, well, let's see what one the root of it is. So the reason why a comprehensive first check will also test for your FSH and your LH is because there's actually two different types, technically three different types of hypogonadism, which is the medical term for low testosterone. Now, I had an MRI done because that's also something you should start with is make sure there's not a tumor on your pituitary gland because that can cause secondary hypogonadism and that's also going to be indicated on the blood work if your FSH and your LH are both low, then it could be a potential sign of a tumor. Now, given that I have a family history of cancer, that was like the first thing that we did, right? Was, hey, let's do an MRI and let's get blood work. We'll have imaging back the next day. We'll have blood work back the next day. We'll hit it from both angles. So, assuming that you don't have a tumor growing in your brain, assuming that your FSH and LH levels are fine, because even without the pituitary tumor, you could still have secondary hypogonadism, which is a different medication than testosterone, actually. You most likely will have primary, which is where your flow is just getting blocked between the pituitary and the testes. Now, for me, the MRI came back clean on the brain. The FSH, the LH came back perfectly fine. The testosterone was low. Now, sometimes it's just a matter of you got a case of the BBs, the broken balls, that you're just not producing. In my particular case, though, I have a very extensive history of documented concussions between football, boxing, and MMA. And my doctor said, look, it's probably just traumatic brain injury because of too many concussions. You can just have your brain rattled around too much. And the last thing that your body is trying to do is reduce testosterone. It's a self preservation. Okay, well, that makes sense, but let's see what I can do. So, diet if you have a higher fat diet, that can potentially boost your testosterone levels. I went keto, like under 50 grams of carbs a day, like 30 grams of fiber a day, so 20 net carbs. And I don't usually like using net carbs, but for something like that, sure. So I did that for 3 of the hardest months.
yeah,
Like did not deviate, didn't drink alcohol, I didn't, and I tried true keto,
yeah.
where your protein is also fairly low. So I tried true keto for 3 straight months. I didn't have a cheat meal. I didn't have a dessert,
It's impressive.
nothing. If it wasn't like avocado, nuts, whole eggs, salmon, super, super fatty steak, like I basically wasn't eating it.
Yeah,
So then I tried a higher protein keto after 3 months, and my test was still in like the one teens.
Yeah.
3 months, another hard 3 months, and no changes, no significant changes. So then I mean, and during this time, like I also experimented with going even lower volume on my training. I experimented with going back to higher volume, and I was getting my lab work done in between. So after 6 weeks, I would test independently and see, did this additional change anything? If the
Yeah.
answer is no, okay, remove it.
Yeah.
So after 6 straight months, and then I tried, after that, I started trying different supplements. Let's give this 10 weeks to work. Didn't do shit. Okay, let's try this other one. 10 weeks. Didn't do shit. I tried saw palmetto. I tried, was it ginkgo
Yeah.
something?
Yeah.
Hell,
Ashwagandha.
I tried the turkesterone.
Yeah. Yeah. Yeah.
Oh man, that was where I drew the line. I was like, I'm not ingesting deer piss. Like that's okay. I spray that to go hunting, not
Oh
to
yeah,
use.
I'm not that desperate.
Yeah. So finally, I mean, it was the better part of a year. And that was whenever I said, okay, nothing I'm doing is working. This is miserable. And ultimately, this isn't going to be a sustainable lifestyle for me. I love potatoes. I love having a good bourbon. I'm not going to sustain this. Even if all of this worked, I'm not going to sustain it. So your doctor should experiment with different things. Now, if you're secondary hypogonadal, then the medication is actually HCG, which is the pregnancy hormone. So that is going to mimic FSH and LH, and that's going to then signal to the testes, hey, produce testosterone, and that's how you're going to get your testosterone levels up. Now, that is a small percentage of low testosterone will be secondary. The majority will be primary. There is also what's considered tertiary, where it's like, hey, everything looks good and your levels are normal, but you still have all the symptoms and your lifestyle habits are all good, and you still need just a little extra help to get you maybe to the higher levels of like 900 to 1200 for you to feel normal, have healthy libido, etc. That's tertiary. And that's an even smaller percent. Like we're talking 1%. The majority will be primary. So your doctor should go from least invasive to most invasive. Now, least invasive is technically going to be um, some type of an oral, like a Clomid. I'm trying to remember what the other one is off the top of my head, and I'm just drawing a complete blank. Someone's probably screaming it right now. So you have Clomid alternative for men. So okay, you have in enclomiphene, which is a it's a compounded version of Clomid. Jeez, I'm trying to remember. This is gonna drive me nuts. At some point, I'm gonna remember it.
It'll come to you.
Yeah. I know guys will use it. I know guys will use it as like post cycle therapy as an alternative from Clomid. And so
It'll come to you.
yeah, the doctor should start with Clomid. That was what mine did. Unfortunately, one of the side effects of Clomid is it can mess up your vision. This isn't going to happen for everyone, but I didn't have glasses until I took Clomid. So the benefit is it can raise your testosterone levels. It's also used commonly for increasing your sperm count. It's a fertility medicine as like an off-label use and for testosterone. So you can get that up. What it does is it's going to signal to LH to increase your Leydig cells, and that's going to lead to testosterone, and it's going to also lead to higher sperm counts. So, because you also have the FSH and the LH still being produced, the Clomid doesn't shut that off. Now, the other thing is if you are primary, Clomid oftentimes will just get your numbers up to mid range of normal. And a lot of guys will feel really good on like 400, 500 for their total test. If their free testosterone also gets up into like the high teens or low 20s, that's still normal. And a lot of guys will say, hey, you know what? My energy's back, my depression's gone, my libido's good. Awesome. Cool, do that because it's just a super tiny freaking pill. It is so easy to take Clomid. It's a small pill. But for a lot of guys, just because your numbers are now mid range of normal doesn't mean that your symptoms are gone. And that was my experience. So I gave Clomid like 5 6 months, I think it was, to work, and I finally just said, "Look, I'm tapping. I'm good. Let's go ahead and go to the injection." Now, the downside with the injection is that by itself, testosterone monotherapy, meaning you're not using any ancillaries, it's going to shut down your FSH and your LH. It's going to decrease your sperm count, and it's likely you're going to see an increase in estrogen. That's not necessarily a bad thing, but you're going to see an increase. So if your FSH and LH are shut down, you're not producing your own sperm. The way around that is you take HCG in addition. So if you're worried about fertility, insist on being on HCG from the beginning. Whenever I got on, that was what I did. After we had Ellie, we were kind of like, don't know if we want to do a second kid. I removed it. But then whenever we decided, yeah, let's do another one, I came off of testosterone to go on HCG to reactivate the testes, to reactivate sperm production, get my sperm count up to a healthy level. And then once it was at a healthy level, luckily for us, got pregnant pretty quickly. And then I was able to, once Jesse was born, come off of HCG just because I'm a minimalist whenever it comes to
Yeah.
medicines, and we were done with Jesse. COVID baby was enough. So so if you're also getting your if you're taking exogenous testosterone, your doctor will likely experiment with the dosing frequency. Now, a super old, outdated protocol is like 200 milligrams every other week. And the problem with that is when you inject, your testosterone level goes up and then it comes way, 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 way down. So if your doctor is prescribing that, it's a really outdated protocol. Probably go talk to a urologist or an endocrinologist instead of your GP because they're going to be more educated on this. Now, a lot of doctors are also getting on board with microdoses, which is what I found works best for me because testosterone therapy can increase your hematocrit, which is a measure of how thick your blood is, which is also going to increase your risk factor for developing blood clots and potentially stroke. So, if you want to donate blood every 8 to 12 weeks, cool. If you don't mind doing that, I do it twice a year, but I don't want to do it every 2 to 3 months. So, lower doses will decrease that for most men. I found that my sweet spot is injecting 3 times a week. So I just do a small dose Monday, Wednesday, Friday. Now, more is not always better because I did have a urologist who put me on 200 milligrams a week, and that was like too much of a good thing.
Yeah. Yeah. It felt
Believe it
too.
or not, that was like too much of a good thing. I found my sweet spot is 150 milligrams a week, so 50 milligrams per injection. That has everything working as it should. I feel at 36, 37 exactly how I should have felt at 24, 25. Now, this is also true TRT because my testosterone levels, whenever I get checked, if I check it the day after my injection, I'm sitting at somewhere between 700 and 800, which is the high end of normal. But for my diet habits, for my exercise habits, that's where it should be. There are men who are natural that will be over 1,000 with good diet and exercise habits. Like, I'd be curious for you to get yours checked.
Yeah, I think like I've never done like a full blood panel before, and so I'm like, oh, I'm kind of curious of like where things are at, right? I mean, especially as I get into like late 30s and coming up on 40 in a few years, I would be curious to kind of see where things are at. I mentioned it to my doctor a few years ago, and he was kind of, and like it was more so like I was just curious. He's like, you're healthy, you don't need it. I was like, okay, that's fine, that's fair. But now I would be curious to kind of see where things are at, just kind of as like I've never done it before, full time natural. Like I would be curious. So I'm thinking about making a doctor's appointment and going to get that done.
Yeah. So I always just recommend it. I always just recommend like have that baseline Novadex. That's what I was trying to think of.
Yeah, I told you,
Novadex
I
does,
told you it'd come.
yeah. So Novadex does everything that Clomid and enclomiphene will do without the side effects, though. So okay, like that was driving me nuts. I would be curious because I wouldn't be shocked if you're one of the naturals that you're just naturally high.
Yeah,
The I know we got to be wrapping this up here, but the thing with testosterone therapy is that it's a lifetime decision.
yeah,
If I come off of it, my levels are going to go back to what they were. I will go back to the exact same symptoms. For me, again, it's a byproduct of having my concussion history. So if you're going to do it, commit to it. If you're someone who says, "Oh, but I hate needles," well, your options are either get over it, or you're going to pay out the wazoo to go to a TRT clinic for them to inject you, and you're going to pay 5 times the price
yeah,
because you need a CNA to alcohol swab you, and then they're going to stick you, and they're going to push the plunger in, they're going to pull it out, put a band-aid on you, give you a lollipop, smack you on the ass, and send you on the way.
yeah. I don't need to pay for that.
Yeah, I mean, I don't need to pay for the needle part, but I wouldn't mind a nice band-aid lollipop. Come on.
Yeah, I'll pay for that. Yeah,
So, all right, look, if you are suspecting that you're experiencing any symptoms of low T, start with your habits, give an honest evaluation, give yourself an honest health audit. How is your alcohol? How is your exercise habits? How's your diet? How's your sleep? Get a sleep study done. It could save your life. Start with those things because if you gave me the choice of, hey, Phil, would you rather have normal, healthy testosterone levels naturally or have normal, healthy testosterone levels because you have to inject yourself basically 3 times a week? Well, I'm going to take the healthy, natural ones. Not that self injecting is a big pain in the ass, it's less than a minute,
yeah,
but it's still one more thing.
yeah, totally. Yeah,
All right. And then the difference of TRT versus being on like a blasting cruise is you are on superhuman physiological levels. And we're not talking about like 1,000 or 1,200 for your
yeah,
total test.
yeah,
We're in the thousands plural.
yeah, yeah,
If you're taking anything beyond testosterone cypionate or maybe a propionate or an ethynate, some people respond better to different compounds, and certain compounds are more common in other countries. But if you're saying, "Oh yeah, I'm on TRT," but then you're on Trin or you're on Dianabol, or there are
anything.
some health clinics that will prescribe DECA for joint health, but let's be honest, unless you're lowering your testosterone
Yeah,
dose to compensate for it, you're on
yeah,
gear.
yeah.
That's the
Simple as
difference.
that.
True TRT is let's get you into normal ranges. Anything beyond that is you're running gear. And that's okay if that's what you want, but let's not get confusion between the two.
Yeah,
So, with
good.
that being said, random useless fact, did you know that a group of bunnies is called a fluffle?
Did not. I'm glad I know
And
that
there you
now.
go.